I have a question on bright light therapy. I know that it's most beneficial in the morning, but for patients who don't feel they can fit it in the morning, would it be okay to do in the afternoon? My big concern is what it would do to the sleep cycle. So it's really best to do first thing in the morning. In bipolar disorder, the recommendation is actually to do a shorter bout of it. So as opposed to 30 minutes, 15 minutes at noon, because it's a little less strong when you do it that way. You could do it at noon as well for a patient with seasonal affective disorder or major depressive disorder. I would not do it later than noon because you're really going to start messing with the sleep cycle at that point potentially. And if you do it later than first thing in the morning, you're also missing out on the benefits that the person gets in helping regulate their sleep cycle. The idea is that that bright light first thing in the morning sets off those wakefulness hormones telling you it's day, which sets off a cascade of hormones that ends when the cortisol starts decreasing and melatonin starts increasing in the evening. So if you do it later in the day, the patient's, let's say, just not getting any sunlight exposure in the morning, they're delaying the whole cycle. What I would ask in more detail with the patient, what specifically is limiting them from doing it first thing in the morning. If they're up and they're like getting kids off to school and they're really just going immediately, then that might be a limitation. But whatever they're doing first thing in the morning, if they could just put the lamp there, even if they're on their computer, if they're reading, if they're sipping a cup of coffee, see if they can just put the light in front of them and they continue doing whatever they were just doing, but with the light on. That's how I would do that.